we at TPN saw an opportunity to kind of take a bite at those elephants and start from the bottom of and the beginning of behavioral health and start to really bring digital order to the entire behavioral health space. And so we ultimately decided to become the home for clinicians.
All right, welcome to The Boost, conversations with people promoting mental health. And I've got two wonderful people here who do just that, in Trevor Colhoun and Sarah Duke. Great to see you both. How are you guys doing?
Great.
Awesome.
Great. Awesome. So stoked to connect with you. We've got a lot to talk about. Trevor's the CEO of TPN, which we'll get into what that organization is doing and really some of the big problems they're solving. And Sarah Duke is the Chief Business Development Officer there. You guys are based in New Orleans, correct?
Yes.
Nice. Okay. And we'll start, as we always do, with two quick questions for you. So one for each of you. So if you both could answer the virtual hug, which is tell us somebody or something you're thankful for today. I'll give it to Sarah first.
Definitely my kids. It's summertime and I have two boys aged 8 and 10. So summer is all about the work-life balance for me and enjoying the beautiful memories of summer when I'm not busy with all things TPN.health.
So work keeps you busy, but your kiddos are that joy in the summertime.
Oh yeah, nice. It's the best. Magical beach moments and all of that.
Lovely. How about you, Trevor?
Staying on the kid theme, I'm with my 5.5-year-old nephew building Legos at night, and his father got him a walkie-talkie spy set. So I've been on calls and he's spying in on me on the corner and sneaking in, and I just love the kid play spirit. It kind of brings levity to everything. I'm very grateful for him.
Beautiful. Yes. This is the first podcast we've ever had recon happening during the podcast, but I'll stay on that theme too. I've never done this before, but I'm going to do a virtual hug to my daughter, who's 9, and the imagination that happens. I mean, 2 days ago, Sunday, I had her just all day. It was a wonderful day, and we built a huge fort. Just imagination play. We were both doctors. We both delivered several babies, and then we went to play pickleball, real life pickleball, not imagination pickleball. And then we went to the pool, and it was just wonderful. I mean, it's just like a beautiful, freeing, timeless kind of experience. So I'm right there with you. There's something so incredible about kids, and we should all be grateful for any type of kiddo in our life, nephew or niece or daughter or son or friend. So that's a wonderful way to start. Trevor, why don't you kick off with the shameless plug, which is this moment in the podcast where we just get to hear best and clearest from the people doing this work. But tell us about TPN and some of the big challenges that you spotted, why you started this, and tell us about the work.
Well, so thanks for that opportunity. The big challenges in behavioral health are almost too big to understand and almost tackle. And we really identified the big problems as the end user doesn't understand the value proposition of behavioral health, meaning I enter in the market and I don't understand who I really need to see and how I really get help from that clinician, and then thus how much it costs if I don't really understand that. And we at TPN saw an opportunity to kind of take a bite at those elephants and start from the bottom of and the beginning of behavioral health and start to really bring digital order to the entire behavioral health space. And so we ultimately decided to become the home for clinicians and a place for clinicians to connect with each other in a safe platform, refer, engage, endorse each other. And then ultimately what brings them together initially is a tremendous amount of continuing education, so they can elevate themselves. They can get maybe just hit their state requirements to maintain their license, learn from other colleagues, get involved with colleagues that they haven't before. And And then ultimately, then what comes from that is everybody can start to see, right? The clinicians can start to see who else is in the market, what they do, what modalities, interventions they perform, what networks in terms of the insurance are they involved with, and really have a marketplace and transparency. And then ultimately where this is going for us is we'll open this up pretty soon to the public, which is not known at this point. We're not open to the public in terms of, my mother, my brother, my friend can't essentially look into the network of clinicians. We're 41,000 licensed clinicians nationally here, and that speed of growth is picking up, which we're excited about. But really start to organize this on an ethical process with a tremendous amount of integrity, but really underlying this our mission, which is to improve behavioral health outcomes. To allow clinical match care to occur. So if I'm a clinician and I might not treat that patient or that client, how do I find match care for them that might fit, their economic needs, their behavioral health needs, and really help and stem that process. And it's exciting. It's very exciting.
Yeah, I can't point to another singular hub and like living, growing community like the one you're building, where it's going to be for the clinician and for the consumer, and one single hub in place. Sarah, you are, let me get it right, an LMHC, let's see, LPC, NCC, is that right?
That's right.
Okay,
Yes.
so from the clinician standpoint, as somebody like developing these relationships, which, I mean, it was like 2 weeks ago you were at 40,000. Now you're 41. I recently, I remember 25,000, 30,000. I mean, the momentum is just snowballing. So talk about, as you talk to these organizations from the clinical perspective, it's so cool to have somebody like you on the leadership team there. What are you seeing from the clinical perspective that you're hearing, oh, this is such a problem solver, or this, I've been wrestling this for years, and here's TPN bringing it to my doorstep? What do you see there?
That's a great question. I mean, starting with the clinician on the clinical front, clinicians are often siloed. They want access to amazing education and they want access to one another. And they have a big administrative burden on a daily basis, keeping up with notes, tracking their licenses, and so on. I think TPN adds such tremendous value for clinicians specifically because it makes all of that so much easier. So, for me, having those two licenses you mentioned, I'm licensed in New York and I'm licensed in Louisiana. Just the very fact that I can get this free account on TPN, track both of those licenses, know when I'm up for renewal, and then access such high quality continuing education to maintain those licenses, that alone is incredible. I mean, before I knew about TPN, I was trying to track via a Google Sheet, doing continuing education all over the place, wherever I could find, try one, free event here. So I'd do it there, and then a free one here or there. You don't need to do that. You can do it all in one place, keep all of your CE certificates together. You're ready for an audit. So it's just tremendously helpful, and especially with the compact. I mean, clinicians are licensed in so many states now and trying to keep up with all of that.
Yeah.
And then, on the organization side, I think having this opportunity to highlight subject matter experts on your clinical team, give them a national audience, it's so important. It's really great to be able to appreciate all the work that's happening and highlight those expertise and your own organization in the process, and share that wealth of knowledge, so that people can really tap in. And to Trevor's point, like, that's how we're really going to improve outcomes, is people coming together and sharing knowledge and starting these conversations. And the last thing I'll mention is collaboration. I'm so excited to see that happening naturally on the platform. We work with really incredible treatment centers, and they're working together. They're hosting events with, multiple treatment centers, bringing educators together, associations and treatment centers, managed care organizations working together instead of, seeing one another as competitors in the market. It's really exciting. I think that's going to be the path forward.
Yeah, you read my mind on sort of the compact question, and then the impact for organizations. And I mean, it's a natural segue also because I've run this mental health marketing conference for 5 years, and to your point about collaboration, we would see this incredible spike in interest and demand in the fall for every event that we did, and then it would go a little bit quiet. And so, I mean, we've announced and we're launching in just a matter of days here while we're recording, August 1st, we're launching a partnership with you all to provide, yes, some continuing education, especially for social workers and counselors and the like. But really, our bread and butter is the marketing and business side of this industry and the education that's really in demand there. And there's a gap that needs to be filled. And so we're sourcing those kinds of educators, and the collaboration opportunities on this platform are endless. So we couldn't be more thrilled to be working with you all. I just want to say that and have it be recorded because it's so true. It's just been great to work with you. You're creative, you're innovative. And you mentioned a number of factors as we think about this ecosystem, but one I haven't heard, what about the payers? Is there a place for the payers? Because you talked about outcomes. Sometimes that leads into managed care or, taking risk. But what about the payer side?
Yeah, that's another shameless plug. So I'm grateful. So we're nationally contracted at this point with United, CVS, Aetna, Centene, Humana, and Elevance. Got it. And what we're doing for them starts with continuing education. So contractually, the plans on each state are required to do a certain amount of trainings for their providers. The beauty of this, which kind of should crystallize the ecosystem of TPN, is once they start doing the continuing education, then they're connected and engaged with their providers. And this gets lost on most people that aren't in the industry, or even people in the industry, is insurance companies do not have connectivity with their providers, meaning they might know they exist. They don't know if they're really in their network. They don't know where they practice, what they provide in terms of modalities, intervention services, the binary aspect, are they available or not? And this data at some point will be available real time to their member network. So their members can say, instead of getting a cold, PDF that has poor data, they'll know who's in network, who's available, what services they provide, are they licensed, maybe get some other information on, might know life experiences of that clinician. And that's where it's going in these relationships. And just watching this, what we're really on the forefront is the digitization of behavioral health, bringing this up to, if we want to, right, make some changes in behavioral health and get to that point where we have efficiencies, you have to organize this place. And that's the wonderful part of technology. Now, there are some unintended consequences, but we hopefully don't play along with and we don't need to talk about. But these are the intended consequences that are extremely positive to help people that need services. I'll say this. We also work with state governments, and we're also going to start taking over regulatory bodies on the back end. So if, for example, if you're Louisiana and you're an addiction counselor, you have to be on TPN. Mainly they're already on, and we monitor what's going on. The difference of pre-TPN and post-TPN, all they knew is that for the most part, that person's licensed in the state, right? So when they're thinking about policy and doing stuff, they don't, understand if that person's practicing. They might just be licensed. I don't know what they're doing. What are they doing? Where are they doing it? What demographic do they serve? What other networks are they involved with? Just a lot of rich data to start them and the states thinking about how they implement policy and how they do these things. We have a contract with several plans to just do health equity, to train the physicians and the nurses and the behavioral health providers on health equity issues, like why someone across the bridge, who might be of different color, has a different life expectancy. And what are the determining factors of that? Or birth rates. Why are birth rates different when someone lives in the same area, same college, same everything? And start to train the staff on things to look for and understand and have empathy on the other side of where that client or patient comes from. And these trainings are possible because we can do them at scale. We can track that people have done that and really monitor that process. So that's what we're doing with the MCO sites. I'll just add a little bit more. We're also starting to go into health systems area. So the third-party administrative companies that are administering health insurance plans for self-insured companies. We're starting to work with a lot of them. They're wonderful because they move fast, and they're really incentivized to bring services to their members. And we can really bring those services. We can bring those clinicians. We can verify those clinicians. We can elevate the education of those clinicians. We can certify clinicians, and so on and so forth. So it's pretty exciting. We're still in the very early stages of all this stuff.
Yeah. But the transparency and connectivity and using that data for clarity and connection, that feels like a step toward weaving the safety net back together for this country of care and weaving mental health care into the bio side of care too, actually.
Yeah. I mean, look, the insurance guys aren't the enemy. Granted, they're an investment house. They're incentivized to have you as healthy as they can be, because then they're not paying for you.
They're the best people to run the numbers on what the odds are of health.
They don't know what to do because they don't have great measurables on outcomes.
And similarly, on the private equity side, I know clinician incentives get mixed into private equity money, but I think it was 2.87 billion in the first half in this Rock Health report went to digital health startups, and 680 million of that was for mental health, specifically clinical indications. And we saw this kind of bump 4 or 5 years ago. It got a little frothy, and things have returned to the mean a little bit with the private equity. And that's because there's course correction on moving fast and doing things well. And there's a lot of smart money being poured into the digital side of behavioral health, which is very exciting too.
Can I make a comment on that?
Yeah.
So I think wave one was really, I think the smart people took the Uberization playbook and said, hey, you're an individual human being, you need a clinician. So we're just going to create that connective technology to do that. What was missed in phase one was really the function of there is no infrastructure or connection to clinicians, right? So I might be said B2C telehealth company, and I'm promising a connection to a behavioral health therapist. They're having a very difficult time maintaining and acquiring clinicians on their supply side to meet the demands of their providers. And for clinicians, it's a horrible equation because they're spending so much money to acquire these clinicians and retain them that they don't have enough money to really pay them. So the therapist is the one that gets hurt here, where they might go moonlight and do some work on a behavioral health telehealth company and really be sorely underpaid. And so what we're focusing on is building that infrastructure of supply of clinicians so they can decide, hey, I'll give you access maybe to some hours, and these are my rates and what's happening, and the B2C would have more economies of scale to pay them because they're not spending so much acquiring them and maintaining them on that process. So that's where we see the future going there.
You bring such a nuance to it, such a comprehensive insight to it. I could talk to you guys for hours, and I've enjoyed every minute of it. I know we're at time. I know you all are busy, but I really would encourage people. I mean, thank you for getting involved with the conference. Thank you for the partnership.
We didn't even really talk about that. I'd like to talk about the partnership.
Let's talk about that more next time. I know Sarah's got to bounce and we've got things to do. So let's do a part 2 of this.
Let's take a few minutes. I'll be late for that because I'm so excited about the conference. And I just want to say that this is why I love TPN, how it can grow and change and solve problems. We kept hearing from our partners, this is amazing, all of the clinical content, but we have other needs in mental health, and marketing is one of them. So it is so exciting to be able to bring that content and also the clinical content that you're now connecting to the conference as well, bringing it all together. I'm so thrilled.
I'm so thrilled. I mean, the clinicians that have done our initial continuing education, which is where we started, we said, where can we start and work, take steps forward, walk before we run. They've loved the experience of the platform. It's intuitive. It's simple to use. We're going to open the doors August 1 for our community. And, yes, you're going to get to knock off some continuing education courses, but the next play where, whether you're a small like solopreneur or a practice, or you're a big multi-site organization, if you focus on addiction or if you focus on talk therapy, those kinds of you can't just say that's all marketing, just like you can't say, it's all one kind of behavioral health. There's different modalities within marketing too, and expertise. So I put the word out on LinkedIn, which is where I put everything on, is LinkedIn. And instantly I got a few DMs from clinicians and other marketers who said, oh, I'm sitting on a whole course of content here that I don't know really what to do with. And I said, let us be your distribution model through this platform and make it worthwhile for everybody, so they're going to win, we're going to win, TPN wins, and the audience and community win. So we're really over the moon about this MHM 365 initiative.
I mean, talk about the practicality. Maybe I run a treatment center, okay, and I'm expanding, and I need to hire marketers, but I don't know if they have the ethics, these marketers, okay, or they understand the process of how I want to market, because marketing is nuance and the process I want to do. So MHM can create bespoke courses and accreditation for these people, and kind of where our technology has come, and they could be taking the course and accredited for the ethics of marketing. And so that owner operator can feel very comfortable that I'm bringing in someone that actually knows what is the appropriate process, because most marketers that come in, from what we've understood and heard, are generally new to the space, and bringing in things that in practicality might seem ethical, but in this case are not.
Yeah, totally.
And there's a lot of nuances there, and this industry has gotten in a lot of trouble, rightly so. And I think there's a way to go about it, and there's a way to bring transparency, visibility, and ethics and integrity to it too. And you're leading the effort. We're just so pumped to have you as a content creator and distributor of this with us.
Yeah, I mean, it's the saying, evil and ignorance have the same consequence, which is, if I'm a marketer that rolls in and I'm just maybe I was at Coca-Cola and I'm like, well, let's tell consumer stories. And, there's like HIPAA compliance concerns, there's privacy and, respect for people's lived experiences. And so there's some bad marketing out there. And it's actually, if you go back 8 years, it's one of the reasons that the person who founded this, Austin Harrison is his name, did it, is to have a conversation about some of the real shady heads in beds marketing that was going on and paid ads. And we had a little bit of an impact there, which was great. And it continues. Not to say everybody's doing that, but whether you're coming in from the outside of the behavioral health space, or if you're a clinician but just don't know the ins and outs of the technicalities of of basic marketing, SEO and advertising, it's all going to be there for you. So
what if there was a platform that someone could trust and come to and see that someone was certified on certain areas, instead of the inverse, which happened for years, is they search Google because their loved one went through a horrible drug overdose and they're desperate to find treatment, and they get attached to some well-intended person that's going to take them for everything you've got and put them in a wrong facility and recreate this cycle over and over again. Let's make it a clinical process.
If only there were a trusted provider network, I guess is what I might call it. Okay. Thank you for extending that. It was wonderful. One last question real quick, speed round to close things out. Tell us something you're consuming content wise. It could be like an album, it could be a book, it could just be a podcast. But what's something that you're taking in these days when you have a few minutes?
I could go first. I don't know what's happened, but I went with a friend and we went to a house music thing maybe 2 months ago during Jazz Fest, and she was awesome. Byrne was her last name, and she did Grateful Dead house music. And ever since then, I've just been on Spotify searching for it because I just love the beat and the dancing and all that stuff. And so I've completely been converted into house music. And I told someone recently, I was like, I like to dance, and they're like, what?
Amazing. Well, there's
you like to sing too, Trevor.
There's that. Yeah, this is not a safe place anymore.
We're revealing secrets. I do too. And in the zeitgeist right now, there's this conversation about how good dancing is for your mental health. I've seen that a few times recently. So you're onto something. You're just elevating. How about you, Sarah?
For me, I'm a fiction reader. I'm a book person. I've been reading The Goldfinch, which is my favorite. It's a long book. It's an incredible book. I need to unplug and just quiet my brain at the end of the day. And that's the best content for me.
So you guys don't hang out at the end of the day doing house music and...
No.
Definitely not. Nor do I have to be honest, no television lately either. It's not serving me anymore, I have to say.
Yeah.
I agree. Great.
Yeah. And I'm old school. I read an actual book.
Me too. Well, I do Audible also, but I love the physical books.
Yeah.
I've been into some Russian literature lately, and it's best because I have to go back and, get the nuance of it all, the names and everything. So the physical book is the way to go, I think.
Well, we'll have to talk literature, Steve, on the next podcast.
Yes.
I like to read the books too.
You like to read the books too? You dance, sing, read. He's a triple threat. Beautiful. Well, on that note, once again, always lovely to talk with you both. And thanks for coming on the show. We'll roll this out in the market. We'll see you in October. More to come for sure. But thanks for everything you've done.
Thanks, Steve. I'm excited for Franklin. Can't wait to see you there.
Yeah, Frank's going to be great. Grateful for having us, Steve. And thanks for the work you're doing. It's awesome.
Yeah.
Absolutely. Thank you. Likewise. Talk to you soon.
Bye.
Bye.